Greetings, people of tomorrow. Welcome to episode 1. Today we will be talking about World Person Healing, the principles of holistic healthcare. Today we have with us Dr. Avneet and Mr. No.
Hi.
Hello.
Okay, Doctor and Mr. No, do you mind giving a short intro about yourself?
Alright, first of all, thank you for having me here. It's a great pleasure. Okay, my name is Muhammad Noor Zulfikri. I'm from Department of Physiotherapy. I'm Kanaya Faculty of Medicine and Health Sciences. I've been working as a physiotherapist since 2009 and in academic, in particular in Utah, since 2016. Yeah.
Alright, Dr. Avneet?
Yeah, I'm Dr. Avneet. I'm a senior lecturer in Department of Preclinical Sciences and I'm Kanaya Faculty of Medicine and Health Sciences. I've been also working in Utah since 2016. So for my background is in basically the medical care. I'm a medico and now I'm moving from academia towards healthcare management.
Alright, so we're really glad to have two very experienced speakers with us today. So just as a short intro, I'm Natalie.
And I'm Esther.
And we are Year 3 medical students and we will be your hosts for today. So first, what is holistic healthcare? For our viewers who aren't very familiar with it, holistic healthcare is a comprehensive, individualized approach to health that considers patients' needs, physical, mental, emotional, and spiritual well-being.
Alright, thank you Natalie for letting us know what holistic healthcare means. Now let's get into our discussion with Dr. Avneet first. So what does holistic healthcare mean in the context of general medicine and how does holistic approach benefit patients?
Okay. Holistic basically is a word which is derived from the Latin word. The whole means holo means whole, the entire universe. Okay, so here we are basically focusing on overall well-being than just focusing on the illness. And we also want to avoid just prescribing the medications, but we want to treat the patient as a whole. Okay, so we really need to listen to patients for this, and we need to understand their lifestyle, their stresses, their relationships, their mental health. Okay, and because all of these influence the physical health and can cause diseases. Okay, so with this we basically are trying to provide a tailored, customized care to the patient. After getting all the input, we try to give the output in the form of a tailored care.
Oh, okay, that's great. So now Mr. No, so what do you think? How does physiotherapy contribute in holistic healthcare?
First of all, I would like to agree with Dr. Avneet that we are treating the person with the disease, not the disease itself, right? So we are not treating low back pain. We are treating patient with the low back pain, right? So as a physiotherapist, we need to understand that there's different factors that influence the outcome of the treatment, right? And we need to really consider these different domains. For example, the biological aspect of it, right? Psychological aspect of it, spiritual as well as sociological part of it, right? Including social economy and so forth, right? And this is in order to bring back the patient for recovery and functioning, right? And how we approach this is we conduct a comprehensive assessment, okay, including all those domains mentioned, and then we individualize the treatment plan. Okay, and not only that, we also promote prevention as well as long-term healthcare maintenance.
Yeah. I see. Very well spoken, Mr. No. Thank you so much for letting us and also our audience understand more about what holistic healthcare means. We will now move on to our second segment, which is we want you guys to share an instance where patient experience in holistic healthcare and how did it impact their overall well-being.
Okay, I'll start for this. Let's take an example of a patient with chronic headaches. I can take my own example in this case. Painkiller is the solution. We can always give a painkiller and get rid of the pain. But there is always some reason behind chronic headaches. So if we take proper history, we try to understand the words and the meaning behind the words, we will understand that there is some issue with sleep, lifestyle, there is some stress, there is some underlying other issues like dietary issues also. And if we try to focus on these in addition to the pain, then we will find better answers, and the treatment that we will be providing will be more comprehensive, and it will be for long term rather than the short term solutions. Okay. So because I tend to have migraine, if I have a sleep issue, but if I take care of my sleep, I'm okay. I get rid of the pain also. So I can avoid painkillers just by focusing on understanding the reason behind the pain.
Right. Thank you so much, Dr. Avneet. Mr. No, do you have anything you want to add on?
I'm a sports physiotherapist by background, right? By training. So my analogy, my example would be biased towards a sports physiotherapist, if it's okay with you.
Yes.
Okay, as the role of a sport physiotherapist, you see, it's to rehabilitate the athletes that is injured, all right, back to sports, so they can play the sports competitively again. Okay, and after a sports injury, for example, if the athletes had injury to the knee, for example, the most common one is anterior cruciate ligament rupture. All right, and of course it's a rupture to the ligament, but the impact of it's not only to the knee, right? It is impacting the other system as well. Okay, and for example, cognitive, right, mental health. Okay, and even social part of it. Okay, right, and in order for them to return to sports, right, one of the criteria is of course the knee function, but it's not only knee function. We have to assess the confidence, right, of the athletes to play back, right, and we have to assess the skills. Have they regained their skills? Do they have a fear of re-injury? All right. So these factors will impact the outcome. All right. So the other factors that usually affect this outcome is depression. All right. A lot of athletes, after they are injured, they will develop depression because, of course, they cannot perform. All right. They cannot do what they love to do. All right. And then if let's say they are injured and the clubs or even the country, they don't want to continue their contract, so they lost their income there. So it put another pressure on the athletes themselves. All right. Okay, and then the other one from the psychological aspect is the fear of re-injury. Although they have fully recovered, but because of this fear of re-injury, they have what we call as kinesiophobia. They are afraid to move, right, because of they are afraid to get the injury, although it is fully healed, right? So somehow it is hampering their performance. They cannot perform 100% like as what they used to do. All right. So what we can do is treating the knee, and then we treat also the mental health. We restore the confidence level, we restore the self-efficacy, and so forth. Right, and of course managing the depression. Right. Yeah.
Okay, thank you so much. Yeah, I think it really puts into perspective how holistic healthcare is really important for not just treating the symptoms, but also all the underlying things that may affect it as well. Okay, so just to add on, in a collaborative healthcare setting, usually how do you work with other practitioners, let's say from general practitioners working with physiotherapists or even TCM specialists? How does that come into play usually?
Okay, so in holistic healthcare, the key is multidisciplinary collaboration. Okay, so like if as a GP, I will have to refer to physiotherapy for the posture corrections, for the movement issues which are causing pain. Okay, I will also have to refer to psychologists to take care of the stress, counseling, and even sometimes to alternate medicines practitioners whenever it is appropriate, because I want the input from multiple angles. And what is good for the patient is good for us.
Okay. Maybe I bring us a little bit out of the healthcare world. Right? In sports, the multidisciplinary is not only between the doctor and the physiotherapist. It involves, of course, the athletes, right? The coaches, nutritionists, the parents if they are adolescents and child athletes, right? Everyone will work together. They're supposed to sit together and be on the same page. So that is how multidisciplinary work in sports, right? So we can manage everyone's expectation. Of course, the athletes want to go back as fast as possible, right? And we as a healthcare, we know that it's not possible. Healing takes time, right? The callus formation happening at this time and not this time. So we understand that, but they don't, right? They have this winning mentality. I'll do whatever it takes, right? Given that I will damage my body as long I can play and win the game. So that is their mentality. So we need to have everyone in the same page, right? To manage the expectation. So that is how multidisciplinary works at the field. Yeah.
Alright. Thank you so much, Dr. Avneet and Mr. No. It really brings light to how like each discipline is important and not one is more important than the other. So this is, I think, a quite common misconception that people think. So that will lead to our next section, which we will discuss about some common misconceptions that, people would think about your respective disciplines. Do you have anything in mind that you can share about?
A very common misconception in holistic is that when we are talking about holistic, it means alternative medicine, and we are trying to move away from evidence-based care. That is a misconception. We are still basing the care on the evidences that we have gained from treating the patients, and we believe in the evidence-based care, but now we are taking the whole context of the patient. Okay, so lifestyle and stress reduction are now very important parts of evidence-based care, and holistic care is not replacing conventional medicine, it's making it better. Okay, so that's a very common misconception. Okay.
For physiotherapy, the general and most common misconception is physiotherapy will only do massage. So that is the common misconception, and I believe different cultures also have their different misconceptions toward physiotherapists, right? And I'm speaking on the Malay point of view, right? Most of my family, my friends, when I say I'm a physiotherapist, they always say you do massage. So it's worldwide lah, basically. Right? And then and people, the second one is people think that physiotherapy is only for injured people, right? Well, it's not, right? It's not only for in treating injury, right? We also promote prevention, right? Prevention of injuries, right? And also we also promote healthy lifestyle, right? Long-term maintenance of health, right? Managing body weight and so forth. So it is not really for the injured people only. Yeah.
Right. So Dr. Avneet, just one more misconception we would like you to address. So we found online, how a lot of people are talking that GP only treats symptoms and not really the root cause. So how would you like to address this misconception?
See, every illness is basically a puzzle, okay? So sometimes we do not have time to find all the pieces of the puzzle. So it takes time. It takes a lot of time to understand that, and it takes a lot of effort also on the behalf of GPs. For now, there are some loopholes in the system. We don't even teach students to listen properly. We even try to tell them that whatever you listen is basically leading you towards a diagnosis and eventually towards treatment. So when we tell them that we have to listen to every word, every single word, and find out the cause beneath the disease, then it will make a difference.
Alright, thank you. So hopefully with all these answers, everyone will have cleared up their misconceptions about both general practitioners and physiotherapists. Alright, so going on to the next segment.
Right, so just a question to the both of you. So are there any challenges that healthcare professionals face in implementing this holistic healthcare? And how do you think that we can address these challenges for a better patient outcome?
Okay. The foremost challenge that we face is we have to ensure that quality care takes quality time. Okay, so the first thing is time is always racing against us. If we try to spend 30 minutes with one patient, and if you see the crowd outside the GP's office, you can imagine that we won't be able to handle even 50% of the crowd. So holistic care takes time to investigate, time to listen, time to collaborate. But with all the schedules and there's so much of paperwork, because whatever we listen, we are supposed to input that information for the benefit of patients and for the benefit of the people with whom we are going to collaborate. Okay, so that finding that extra time is like finding a needle in the haystack. Another thing is education and training. Our education, the one that we have and then that one we provide actually, unfortunately we do not give it the spotlight, the holistic care that people deserve. Okay, so it's like the underdog of medical education. So they are students, and we even feel that we are ill-equipped to understand the nuances of this holistic healthcare, and we need to make some changes in the near future.
So how about Mr. No?
My points also revolve around Dr. Avneet's point. First is, of course, a time constraint. Although we think that the physio will face the most challenges. For example, we treat patient for 1 hour. Right? We manage a patient for 1 hour. 30 minutes is for assessment only. But after listening to Dr. Avneet, even spending 10 minutes also, it's very, very hard for the GPs, right? So, yeah. So that is the first and biggest, I think, time and biggest challenges, the time constraint, right? Okay. And the second one is the lack of evidence-based practice. We know that we have to actively listen, but we don't have time to do that, right? And we have to shed the decision making, but we didn't do that. Right? So we know a lot of things, but we are not able to do that. Right? And then later this skill will disappear. So we need to keep on teaching the future physiotherapists, future healthcare provider, that this is important. Right? This should be emphasized. However, because of these challenges, we cannot really practicing it.
All right, thank you so much to the both of you. I think that was a very insightful session. Just to summarize for all the people listening, and also as a learning experience for both of us. So I believe that holistic healthcare means whole body healing, in which case you're not only treating them for why they came in, but what is the cause of that they're coming in, and if there's any other underlying issues that they have, be it mental health or maybe it's another cause. So I think there are many challenges faced, as you both have provided so many examples on why why it takes such a long time, why it requires so much communication between different disciplines. Yeah, so it's a place we need to work towards, but hopefully we will get there someday.
Yeah. Alright, so time flies just as how we see our patients. So we're gonna come to an end. Before we end, do you guys have any last words?
Yeah, I will just like to add that with regards to holistic healthcare, we are basically lacking behind in the perspective that we need to leverage the use of digital tools and technology. And the technology is the one that we can definitely use, and it can help in the seamless this integration of all physical, mental, psychological, all the care. And it is going to be very wonderful, because once we ask the patient whether you're sleeping properly, whether you're eating properly, if they are maintaining a journal, it's just a 2 minutes job if we just go through that journal. So I'll just hope that in the future we'll have some technology that can help us reduce the gap between these three cares, and we can do better in this.
And I just have a question for Dr. Avneet. Do you have any models that you follow for this holistic approach?
There are no such models as such, but the latest model that we are using in holistic healthcare is value-based care.
Value-based care.
We call that system as a value-based care. Now, instead of like the thing is coming from a financial viewpoint. So instead of compensating the insurance companies, compensating the healthcare provider for the treatment provided, they now basically compensate for the value provided. The value comes from how the patient is feeling at the end of the treatment, not from the medicine that was prescribed. Like we give the pain relief is not the value. The value is long-term pain relief, no freedom from, like it's like the freedom from pain for all over
Okay.
for a long time. So the value that patient will tell us whether I gain some value from the care. So that is the holistic model that we approach to reach. But for now, it's a bit vague. Yeah, it needs to be defined very clearly, because otherwise it's just going to end up as like insurance companies will stop paying you.
Yes, because I think previously it's a biomedicine model.
Yeah, it was earlier biomedical social. Yeah.
But the model is, I think, created 50 years ago.
Yeah.
And doesn't evolve since then.
Yeah,
So I think it's it's not going anywhere with this. Yeah. But and it's still being taught in medicals, in physio schools, like, basically. Yeah. So maybe we should consider the other models as well.
Right.
And I'm quite intrigued about the reimbursement policies that you have mentioned.
Care.
Value-based
care. Because there have been issues like suppose a cancer care patients are given chemotherapy, and after the chemotherapy patient is not satisfied. Patient just doesn't want the treatment. They want a proper medical device, dietary advice. They want what to do, what not to do. They want the advice regarding the caretakers, like what should the caretakers do. They want to know when to come again to the hospital. These are the advices which are not covered inside this value based.
I see.
So these are the things that we need to provide to the patient to add value to that model and provide the whole care, like holistic health care.
So in order to improve this, I think it involves multiple layers, starting from the policy maker.
And starting from the educational spotlight, we need to
well
provide education regarding this first.
Insurance company also.
Right.
So I think it's a lot of work. But I hope we are moving towards that direction.
I think this podcast is a right step in the right direction.
I totally agree.
So Mr. No, do you have anything to add? Alright, so thank you so much, Mr. No and Dr. Avneet. We really enjoyed this entire session, especially the interaction at the end. It really showed us that, different disciplines can help each other towards a better future. So we would like to thank you two. Very thankful for you guys for coming. And we would like to thank the audience for listening, and stay tuned for our next one.
Thank you for inviting.
Thank you for having us.
Alright, so we have a bit of tokens of appreciation for both of you.
So this is for Mr. No.
Thank you very much.
Dr. Avneet.
Thank you.
Oh,
and some chocolates.
Chocolates. Wow.
Very belated.
I'm a very fine celebrity now.
Thank you.
Yes. We will go outside.
I can tell that to my family.
Yes, of course. We will stand outside for your autograph later.
I think
Thank you so much.
mixed up. This is your name.
Oh, okay.
Very nice one.
it's
I really love the
yeah.
design. Thank you.
Alright, so can you guys have a seat again?
Oh, okay. I think finish already.
You need to say your last ending.
Alright, so again, we would like to encourage our listeners to advocate for holistic healthcare in your personal and also professional life. So just so you know, we would love interaction for you guys with us, so feel free to comment down below and subscribe to this channel. Or you can always go to our Instagram page at AMSA UTAR for more information. That is all for today. Viva AMSA, and stay tuned for the next episode.
Thank you.